Hi, so I'm here to tell you a little bit about my experience with contact lenses, especially scleral lenses or EyePrint. I have been dealing with keratoconus now for about 20 years or so, and when I moved to Arizona in the late 90s, I just went to a regular optometrist that started to notice certain things. So I started my keratoconus journey with a doctor down at Osborne, who basically told me I was going to be legally blind in my right eye and I would never see 20/20. I had been wearing glasses up to this point, but of course glasses weren't working. So the first thing I tried was hard lenses, which didn't last very long. I have very dry eye, I have allergies and eczema, and it was really hard to wear here because of my eyes being so dry. So I was getting frustrated with hard lenses, so I went back to glasses, which always made me see okay, but just not as sharp as I would like. I was told I needed punctal plugs for my tear ducts and just basically not getting any good news at all. So I decided to forget hard lenses and I went back to wearing glasses 24/7 with prescription sunglasses and regular glasses all the time. I'm very active, so I also like to be outside. I like to be in the water, and that's kind of hard with glasses on. So I got frustrated. My second trial, I went to the Mayo Clinic with high hopes. And when I got there, I was basically told all I could do was piggyback contact lenses. That is a soft lens underneath with hard, rigid gas perms over that. So that is 4 contacts total, totally different maintenance system. Just very, very time consuming and very uncomfortable. That was all they had to offer me. I was never as severe with keratoconus as far as needing a transplant or anything like that. And I'm not interested in any kind of surgery. I don't need it. So I tried piggybacking, thinking that was the end all for me. And I remember being on a family vacation. I was in my probably late 20s at this point, early 30s. And everyone was trying to get ready to go to dinner, and I'm struggling with my contact lenses, and I get one set in, but then I can't get the other, and dealing with 4 lenses at a time twice a day is really difficult, and I ended up just throwing them at the mirror and saying I give up. So again, I went back to glasses 24/7 for a couple of years. Then I got into an ophthalmologist practice close to where I work and where I live, and I was doing pretty well. The optometrist there worked with me on rigid gas perms again to try, which he did pretty well with that, but eventually I couldn't wear them anymore. And so then scleral lenses became more affordable and more accessible. So I got into some scleral lenses. And this lasted, I probably did that for about 5 or 6 years. But then again, I got real tired of the maintenance, of me having to take them out several times during the day. And I also never really saw great at night. I was always striving for that sharp image. And I was told throughout this whole journey, I'm a great interpreter of blur. Which when you're driving your kid around and you're working full time and you're doing a lot of stuff, you don't want to be seeing blur. So I just gave up again on scleral lenses, and I had been wearing glasses for several years now before I saw Dr. Morrison. And the way that came about is my husband is a graduate of the College of Medicine at the University of Iowa and received an alumni magazine, and right on the cover it said keratoconus. I forgot what it said, but it said something about there is hope. And I opened the article and it talked about a doctor from my hometown in Colorado who has created these lenses that are specifically made for you and your eye. And so we were gonna fly out there where I could visit family and make a whole deal of it. But then on her website, it said, find someone near you. And lo and behold, I found Dr. Morrison. So I have now been seeing her for 3 years. I just got my second set. My first set of EyePrint lasted those 3 years, but it was definitely time to renew. And I just got my second set, and now they have added high order Aberration, which takes away all my ghosting at night and glare when I drive. And my kid plays high level competitive soccer and is often on the field at nighttime because he plays when it's hot and plays pretty much year round. And I couldn't even see him on the field. With this high order Aberration on top of the EyePrint custom fit lenses, I don't think I've ever seen so clear. I don't have to take off sunglasses, put on glasses. Like when we go to Universal Studios, you would walk in a room, take off the sunglasses, put the glasses back on. You'd go swimming, you couldn't see the fish. Now I just keep these on all the time. They are totally comfortable, and I have never had such sharp vision. So not only the sharp vision, again, the comfort, I've never had it before in 25 years of dealing with this crappy eye thing. So thank you, Dr. Morrison. I would tell people, keep on searching for something that works for you. Don't give up. It's okay if you give yourself a break and wear glasses for a couple years, but just keep looking around because there is hope and it's working. So thank you.